Cancer cells love sugar. As many of you know, cancer remains the second leading cause of death in the United States.
Every day, millions of cells in your body divide, grow, repair damage, and then die, all without you ever noticing. This process is happening right now, silently and precisely, guided by one of the most sophisticated control systems in biology. But what happens when some of those cells stop listening to the rules? What happens when a cell forgets when to stop growing, forgets when to die, and begins to multiply without control? That is where cancer begins. Cancer is not a single disease, not a sudden event, and not something that appears overnight. It is a gradual process that starts deep inside the body, at the cellular level, long before symptoms appear. In this video, we're going to explain how cancer actually grows inside the body, using real science, real medical understanding, and real doctor-based explanations, calmly, clearly, and without fear. Understanding how cancer grows helps remove confusion, fear, and misinformation. Knowledge gives clarity, and clarity gives strength. Cancer statistics. Cancer is far more common than many people realize. Statistically, about 1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer at some point in their lifetime. These numbers can sound frightening at first, but statistics alone don't explain what cancer truly is or how it behaves inside the body. Cancer does not mean the same thing for every person. 2 people can have the same type of cancer in the same organ and experience very different outcomes. That's because cancer is deeply individual, shaped by genetics, environment, immune response, and cellular behavior. To understand cancer properly, we must first understand how healthy cells normally work, how normal cells function in the body. The human body contains trillions of cells, each with a specific role. Some cells form organs, some transport oxygen, some fight infections, and others repair tissue. These cells are governed by strict biological rules. They know when to grow, when to divide, when to repair damage, and when to die. This process is controlled by DNA, chemical signals, and built-in safety mechanisms. When a cell becomes damaged or reaches the end of its lifespan, it undergoes a natural process called programmed cell death, allowing the body to stay balanced and healthy. This balance is what keeps tissues functioning normally. Cancer begins when this balance is lost. What is cancer? At the cellular level. At its simplest level, cancer is a condition where certain cells lose the ability to follow normal growth controls. Instead of responding to signals that say stop growing or self-destruct, these cells continue dividing. They survive when they should not. This loss of control usually happens due to mutations in the cell's DNA. These mutations can occur over time due to aging, environmental exposures, inflammation, lifestyle factors, or sometimes inherited genetic changes. Most of the time, the body repairs or destroys damaged cells. But occasionally, a cell survives with these errors, and that is where cancer can begin. From a single cell to a tumor, cancer does not start as a large mass. It often begins as one single abnormal cell. That cell divides, and its copies inherit the same faulty instructions. Over time, this cluster of abnormal cells grows. When enough of these cells accumulate, they form what we call a tumor. Not all tumors are cancerous. Some tumors are benign, meaning they grow slowly and do not spread. Cancer, however, refers specifically to malignant tumors, tumors that can invade surrounding tissue and spread to other parts of the body. Why cancer is called malignant cancer cells differ from normal cells in several important ways. They grow faster. They ignore signals to stop dividing. They resist cell death, They can invade nearby tissues. Most importantly, cancer cells can spread. This process is known as metastasis, and it is what makes cancer potentially life-threatening. Cancer cells can break away from the original tumor, travel through the bloodstream or lymphatic system, and establish new tumors in other organs. Cancer can occur anywhere in the body. Because cells exist everywhere in the body, cancer can develop in almost any organ or tissue. In women, breast cancer is one of the most common forms. In men, prostate cancer is very common. In both men and women, lung cancer and colon cancer remain among the most frequently diagnosed cancers worldwide. Each type of cancer behaves differently because each tissue has unique cellular functions and environments. Why every cancer is different. One of the most important things to understand is that no two cancers are exactly the same. Even cancers that appear similar under a microscope can behave very differently. A lung tumor in one person may respond well to treatment, while a lung tumor in another person may not, even if both are diagnosed at the same stage. This is because cancer is not uniform. Within a single tumor, there may be multiple subtypes of cancer cells, each with different genetic characteristics. This diversity is one reason why cancer treatment can be so complex. Cancer staging. Once cancer is diagnosed, doctors focus on several key questions. Where is the cancer located? How large is it? Has it spread to nearby lymph nodes? Has it spread to other organs? This information is known as cancer staging, and it plays a critical role in deciding treatment options. Early-stage cancers are often more localized, while advanced-stage cancers may have spread beyond the original site. Why cancer treatment is so complex. Cancer is not one disease. It is a group of over 200 different diseases, each with unique biological behaviors. Even within one diagnosis, such as breast cancer, there are multiple subtypes defined by hormone receptors, genetic markers, and growth patterns. This complexity explains why a treatment may shrink a tumor significantly, but not eliminate it entirely. Some cancer cells may be sensitive to treatment, while others are resistant. The three main types of cancer treatment. Traditionally, cancer treatment relies on three main approaches. Surgery physically removes the tumor from the body when possible. Radiation therapy uses targeted energy to damage cancer cells and prevent them from dividing. Chemotherapy uses drugs that circulate through the bloodstream to kill rapidly dividing cells. Each of these treatments has benefits and side effects because they can also affect healthy cells that divide quickly. Why side effects occur. Cancer treatments aim to destroy cancer cells, but they can also impact normal tissues such as hair follicles, digestive lining, and bone marrow. This is why patients may experience fatigue, nausea, hair loss, or weakened immunity. Modern oncology focuses on balancing treatment effectiveness while minimizing harm to healthy cells. Integrative oncology. Many cancer centers now use an approach called integrative oncology. This combines conventional cancer treatments with supportive therapies such as nutrition counseling, physical rehabilitation, acupuncture, stress management, psychological support. The goal is not only to treat the cancer, but also to care for the person living with it, treating more than just the tumor. Cancer affects more than the body. It affects emotions, mental health, and quality of life. Pain, fatigue, anxiety, and depression are common experiences after a cancer diagnosis. Modern cancer care recognizes that treating these aspects is essential for healing and recovery. Managing symptoms improves outcomes and helps patients maintain strength during treatment. The role of precision medicine. One of the most exciting developments in cancer care is precision medicine. Doctors can now analyze the genetic profile of a tumor, identifying specific mutations that drive its growth. This information helps guide treatment decisions, allowing therapies to be tailored to the individual cancer, rather than using a one-size-fits-all approach. This personalized strategy is transforming cancer care and improving outcomes for many patients. Why there is real hope today. Cancer treatment today is more advanced than ever before. Options that did not exist a decade ago are now available, and research continues to evolve rapidly. Many cancers that were once considered untreatable can now be managed long-term. Survival rates continue to improve as understanding deepens. Hope does not come from denial, but from knowledge, science, and progress. Empowerment through understanding. Understanding how cancer grows inside the body helps remove fear and confusion. Cancer is not random chaos. It follows biological rules, and those rules can be studied, targeted, and treated. Knowledge empowers patients and families to ask better questions, make informed decisions, and take an active role in their care. If you found this explanation helpful, educational, or reassuring, please subscribe to this channel. We create science-based, doctor-informed videos designed to educate, support, and empower people affected by cancer, calmly, honestly, and responsibly. By subscribing, you help this channel reach more people who are searching for clarity, understanding, and hope. And remember, you are not alone, and knowledge is one of the most powerful tools you have.